Good evening to all. I'm Dr. Manuzak. I'm a breast and endocrine surgeon working in Kerala. This Stitch Mart workshop. So recently I've conducted this offline workshop in my hospital to my interns and my surgical residents, and they've received it really well. Thanks to Magister Chirurgiae, for giving this opportunity to teach you all regarding the suturing techniques. So this session will be on the basic suturing workshop. So I would like to introduce regarding the basic suturing techniques and a few slides about the suture materials as well. So you should know what you're suturing with and the type of materials, when to use which suture, all these things you need to know. So I'm starting with that. So we say that excellent surgeons begin with excellent basic techniques. So it's this basic techniques actually which is a root for everything. So the learning objectives for today's workshop is to understand the basic suture materials, to learn instrument handling, how to hold and how to handle it, and the different techniques, obviously, and the hand knot practicing. So sutures can basically be divided into natural and synthetic. Natural suture materials, actually, the broad classification is absorbable and non-absorbable. So in absorbable, there is natural and synthetic. In non-absorbable also, there is natural and synthetic. So in absorbable sutures, the natural sutures are plain catgut and chromic catgut. The catgut, it's made from the mucosa of the cat and intestine, sheep intestine. Synthetic sutures includes polyglycolic acid, it's known as Dexon, polyglactin, polydaxone suture, and polyglycapron. Coming to non-absorbable sutures, the natural ones is the silk, and synthetic ones includes the polypropylene, which is a proline, monofilament polyamide, ethylene, polyester ethibond, or nylon. So the difference is the polyfilament it's called braided sutures, the multiple fibers of suture materials braided together. Whereas monofilament, there is only like single filament, it's not braided. And there are advantages and disadvantages, and you need to when to use this monofilament and when to use this polyfilament or braided sutures as well. So the difference is braided sutures, it has increased infection risk because if you look at these sutures, you can see that it's braided. So there is a chance that bacteria can get lodged in between the crevices of these braided sutures. So it's not advisable to use this braided sutures outside the body, so that is over the skin. So we don't usually use braided sutures to suture a wound over the skin because actually, obviously the skin has bacteria over it. So there is a chance that this wound can get infected. So we don't usually recommend the braided sutures for open skin wounds. So we use the braided sutures, the different materials inside the body. Okay, and the braided sutures has less tensile strength, but the handling is good compared to the monofilament sutures and better knot security. Those are the advantages of braided sutures. Coming to its tensile strength is really good compared to the braided sutures, but it has another disadvantage. It's the memory is very good. Memory of a suture means as soon as we leave the suture, it comes to its original position. That's called the memory of the suture. So monofilament sutures has a good memory, so that's why it's a bit difficult to handle, but the tensile strength is much better compared to the braided sutures. And to secure it, you need more throws when compared to a braided one. And the infection risk is less because it's a single filament, so you can use it over the skin and doesn't have a capillary action. So broadly, we can classify of suture materials into absorbable and non-absorbable. And absorbable can be classified into braided and monofilament. So as I said, braided and absorbable includes vicryl, monocryl, all those sutures. Whereas monofilament absorbable includes monocryl, polyglycapron, PDS, etc. Non-absorbable sutures can be braided again on non-braided. So the braided includes silk, polyester, and monofilament non-absorbable includes nylon, ethylene, and proline sutures. Next, coming to the suture size. If you take a suture material, the packet, if you can see this, the numbering outside the suture. So what are these numbers actually? So we can see the number corresponds to the thickness of the fiber. Okay, so here zero, it's a 2 0 and 3 0. 2 0 means literally 0 0, two zeros are there. 30 means 000. So the more the number of zero, the more thin the suture material is. So a 60 is much thinner than a 20 because the more the number of zeros, it gets thinner. So for the corneal suturing and all, they use 80 to 10 sutures because it's very thin and fibrous. So you need loops to for this kind of suturing. So the 0, 1, 2, 3, those are the thicker ones. So that's about the numbering of the suture. And coming to the suture needles, it has a swage with, you can see that the needle is attached to the thread is attached to the needle. It's called the swage of the needle. And the needle, it's very important because different types of needles are there, half circle, 1/4 needle, J-shaped needles and all. So what you need to understand the basic principle while handling a needle is you need to hold in like the needle driver on the needle at the 2/3, 1/3 junction. So if you see the needle, this is a 2/3. And are you able to see my pointer? I hope yes. Okay. So you need to hold the needle, a needle driver at the 2/3, 1/3 junction. So this is a 2/3, this is a 1/3 junction. Okay. So these are the different types of circle. You can see the half 1/4 circle, 3/8 circle needle, half circle, 5/8 needles, even straight needles are there. So and different shapes are there. Like we can see, you can see the cutting needles, reverse cutting, round body, and blunt. So we use cutting needles for the skin and the round body for the tissues inside. So the skin, because the skin is very tough, you use always reverse cutting or the cutting needles. So the types of suturing techniques which we are going to learn today includes a simple sutures, vertical mattress, horizontal mattress, continuous, subcuticular, figure of eight, and hand knot techniques. These are the techniques which we are going to learn today. And hand knots obviously one-handed, two-handed knots and surgeon's knots. So this is a brief introduction about the different types of suture materials, and you should also know like when to use which material. So as I said, we don't use braided or polyfilament suture for the skin. Skin we use monofilament. What we use usually is a nylon. It's a nylon is what's a monofilament, non-absorbable suture, which we use for the skin. Whereas for the subcutaneous closure, we use polyglactin or the Vicryl, that's a company name. Polyglactin we can use, or subcuticular, we can use polyglycapron or monocryl. So again, it's a monofilament suture. And for silk is used for tying the vessels, which we don't use it outside. We use it inside the tissue for tying the vessels, blood vessels. For taking it all these, we use the braided sutures. So this is a brief introduction about the types of materials. I'll take any questions. If you have any doubts, you can ask me now.
Thank you, Doctor. That was very informative.
Yeah.
Any questions from the group? Okay, so we will now begin the video demonstration. Kindly
Okay.
turn on your cameras so that the surgeon can observe your technique closely and offer guidance and corrections where necessary. Please feel free to put your questions in the chat box. Participants, kindly turn on your cameras for live observation and feedback from the surgeon. And kindly drop your questions in the chat as we proceed. We'll address them during the Q&A session at the end. Thank you all for turning on your cameras. We appreciate your participation. We are now waiting for Dr. Manu and we'll begin shortly once he's ready.
Am I audible?
Yes,
Uh,
you are.
am I audible? Can someone respond?
Yes, we can hear
Yes.
you.
Yeah. So is the video visible? Is it clear? Can I go ahead?
Yes, it's visible. Yes, thank you. Yes.
Yeah. So if there is any issues, any glitches, so just please let me know. Okay. So first,
All
I'm gonna start with so the technique of holding the needle driver to start with that. Okay. So this is a needle driver or the needle holder. So I'll tell you how to hold it. So first we have to put the thumb inside and the ring finger inside. Okay. And with index finger, we'll guide it. So this is how you hold the needle holder. Okay. Is it clear? So it's a ring finger inside here and the thumb here. So this is how we hold a needle holder. And we should have the forceps in your left hand. You hold the forceps just like a pen, how you hold a pen. So this is how you, excuse me, this is how we hold the forceps. Okay, is that clear? Can I move ahead?
Yes, you can move ahead.
Yeah.
Clear.
So, so first, the suture material, what I'm using is a vicryl, which is a braided or a polyfilament suture. You can see. Okay, you can see here. So again, I'm going to show you where to hold the needle driver. Okay, if you can look, if you look carefully, I'm holding it at the 2/3, 1/3 junction. So this is the 2/3, 1/3 junction of the needle holder. Needle, sorry, the needle. Okay, that's where I'm holding it. And you should hold the needle at the tip, with the tip of the needle driver or the needle holder. So this is how you hold a needle. Okay, and you look at the finger positions and you're going to drive it guiding with your index finger. So this is how we're going to hold it. So the first technique which I'm going to teach you is this basic simple interrupted sutures. So I'll just demonstrate it first. So imagine this is a wound, this is a cut wound. So I'm going to demonstrate the simple interrupted suture. The principle is we have to enter at one point here and exit from this side of the wound. It should be equidistant. So if you enter at the same distance from this edge of the wound, you should exit at the similar distance from this edge of the wound. Okay. So while entering, the most important thing which we have to be careful, or the most important technique is we have to enter perpendicularly. You have to drive the needle perpendicular. Like we have a tendency to enter like this. This is wrong. This technique is wrong. So turn your wrist and always manipulate your wrist. That's when the suturing will become easy. So enter perpendicularly at an equidistant. With using your forceps, you invert it and just gently twist your wrist. That's all. So, and with your forceps, hold the needle again. Again, 2/3. Hold the grasp the needle at 2/3, 1/3 junction. Again, the same line, equidistant, you have to enter it again and twist your wrist. Just twist your wrist, the needle will drive in easily. Okay, then just pull out the thread. So this is the, you have a tail end of the thread and this is the long end. So this is a short end and we have a long end. So again, there's another principal technique here. So imagine this as a V. You can see a V here. I hope it's clear. Okay, the V of the suture. So what you have to do is keep this needle driver always inside the V. And using your left hand, the suture, this thread should be lax. This shouldn't be tight. The more tight this longer thread is, the shorter thread will become even more tighter. Okay, so we have to keep this lax, this end, and stay inside the V and wind this around the needle drive. Again, I'm going to show you again. So there's a longer thread, there's a short thread, there's a V. Stay inside the V, wind this longer thread around the needle driver and grasp the short end. Okay, then square it. This is called squaring of the note, what I'm doing. Okay, you squared it. So that's how you hold the needle driver inside the V. And so should I demonstrate it again? Is it clear? Please speak up if you have any doubt.
It's clear so far. Thank you.
Okay. Okay. Someone else has to do it again. Yes, I will do it again. So you have to catch the needle hole of the needle at the 2/3, 1/3 junction. I hope the video is clear. Like the zoom in is okay. I think you can see. Is it? I hope it's clear.
Yes, sir.
Yeah. Yeah. Okay. You can zoom in a bit if you need to. see a bit more enlarged. Again, I'm gonna show again, don't worry. So this is a 2/3, 1/3 junction. We're gonna grasp the needle with the needle driver at 2/3, 1/3 junction. Okay, again, I'm gonna adjust it towards the tip. Okay, we're gonna enter perpendicularly. Again, this is the second switch I'm taking. So I'm gonna enter perpendicularly from the edge of the wound. Okay, enter perpendicularly. Once I'm entered, once I see the needle, you can just look at my wrist. I don't know whether you can see it. If you can see it, look at my wrist. I'm gonna gently twist it. So this motion. So once I twist, the needle is out. So that's the curvature of the needle. So one thing you don't have to, manipulate the wrist a lot. Just twist your wrist. Once you see the needle hole, the needle tip of the needle, just twist your wrist. It's out. Take the forceps. Don't leave the needle driver. Take the forceps. Grasp the needle with the forceps. Once you grasp, leave this. Okay, once you grasp it properly, leave this. Okay, and pull it out. Stabilize this with your right hand. Don't pull it out. Okay, so you're gonna enter the other end. So we have to enter at the same line. So if I'll demonstrate it, I'll just write down with the pen. Okay, so this is a point. So if you have entered here, if you have entered here, you have to exit at the same distance. So this point. So if you can see, this equidistance from the wound edge. So again, I'm going inside the wound. I'm coming out at equidistance. So once I see the needle, you don't have to go very much deep for this. So once I see the needle, okay, I just twist my wrist. See, and it's out. I'll gently pull it out. Okay. So again, so here, so pull it out so much so that you don't waste much of the thread. Okay, keep this end really short. So you need to just suture it. That's it. So you have a long end and you have a short end. Okay. So what you're going to do is keep this long end relaxed or lax. So you need this one to suture. So again, this is a V. This is a V. Stay inside the V. Wind this long thread around the needle driver. Can you see it? Okay, I'll do it again. Stay inside the V. Using your left hand, hold the thread. Wind it around the needle holder. Or with the needle holder itself, you can take a throw like this. So once you're good enough, once you practice a lot, this is how we do it. So before that, to just know the concept, you can wind it around. 2 throws. I'll show again. Stay inside the V, long thread, 2 throws. Now, with the needle driver, grasp the short end of the thread. Okay, and square it. See how I'm squaring. So this is a proper squared knot. Okay, so this is tight. So I've squared it. Okay, so again, this you need to take 2 more throws. So this is a V again. Stay inside the V. Single throw. Grasp the short end. Square it again. Okay, this is a V again. Stay inside the V. Single throw. Grasp the short end and tighten it. Okay, so and take the scissors and cut short. Okay, so this is the simple interrupted suture. If you have doubt in any steps, let me know which step you have doubt in so I can clarify it further. It's difficult initially, but once you practice more with the suturing paths you have, you can easily learn it. It's not very difficult. And these are the wounds, like, in cash, when you work in casualties and the people come with a wound, the superficial wounds, you can do a simple suturing. The deeper ones, you need the mattress ones, which I'll teach you next. So the material which we can use for the skin is monofilament ones. You can use nylon. That's a better one, or proline. So nylon is the best one to suture the skin, and you can put 20 or 30 number sutures for the skin wounds, the superficial ones. You have any doubts?
I hope everyone is following along well so far. Feel free to continue dropping your questions in the chat box or raise your hand virtually so that we can address it.
Excuse me, sir.
Yeah, please.
Sir, I've actually tried to make the simple interrupted suture. Could you please check if it is all right?
Yeah, can you just demonstrate me? Like, how did you suture? Yeah, can you just show me?
1 second, sir.
Yeah.
Sir, I'm unable to actually adjust my camera and hold the needle.
Okay, okay. Just show me the knot which you've made.
Just one, sir.
1 second, I'm not able to see.
So is it visible, sir? It is.
Mm, uh, Actually, I'm not. Can the moderator help with that? Yeah. Yeah. Who just spoke now? Yeah, yeah. I'm able to see a
I
lot of
spoke, sir. Amukta.
Amukta. Okay, okay. Yeah. Yeah, this might not, the material might not be bit, you won't be able to approximate it because of this material. It's silicon. Silicon is usually like that. So you won't be able to approximate it tight, but it's easier to suture in, live tissues. It's even better. Okay. So this looks okay. And you need to cut it a little more short, the threads. As
Understood,
if,
sir. Yes, sir.
yeah, as I've shown, yes.
Yes, understood, sir.
Yeah, yeah.
Thank you, sir.
Yeah, and all, so suppose if this is a wound, can you see my screen? Yeah, if this is a wound, is a linear wound of 5 centimeter, all your interrupted sutures must be equidistant. The distance between these two sutures, if it's 1 centimeter, your next suture should be at 1 centimeter from here. Okay, and the tension on the suture line should be minimal. So if you see, like some patients, like you can see, the basic thing is you can suture. Like if you ask someone to suture, they can suture in any way. So the thing is, are you suturing in the right way or not? So if the tension on the suture line is more, that will end up in scarring, end up in a big scar. Okay, the lesser the tension on the suture line, the thinner the scar is. So that's a concept. This is a key concept in plastic surgery. In plastic surgery, this is a concept they use to minimize the scar. It's nothing, just reduce the tension on the suture line. So that's one on deep wounds. That's why we take a subcutaneous suture to reduce the tension and then put the superficial skin sutures. So always your suture shouldn't be too tight or too loose. It should be just approximating to wound edge. So that's a key, okay, for a beautiful scar. Yeah, I can see Lakshita suturing. Yeah,
Yes, sir.
Apeksha. Yeah, Apeksha. Yeah, that's the way, the proper squaring. Good. That's a good job. Don't cross your hands. You just turn your hands. Apeksha. Rest everything you did fine.
Okay.
Okay. Thank you, doctor. Next, we have a question from Anuj.
Yeah, Anuj, hi, tell me. Anuj, you're not audible. I think you need to unmute yourself.
Good afternoon, doctor. Actually, I
Yeah.
wanted to ask, sir, can you have a please that first have a look at what I've done with this suture material? Is it right?
Yeah, the approximation is good, but I think you have cut it too short. So what
Okay.
happens once we cut too short is, like
Mm-hmm.
once once there is tension on the suture line, the thread might get loose. So you need to have, like, if you look at the video, like I can just show, I can just zoom in. So this is the length which I've kept. I'll just show you. So this is the minimum length which you should have. Can you see?
Sir,
Is it clear? So this is the length. So that even if there is a tension on the suture line, it won't get loose. Okay.
uh, sir, another question.
Yeah.
While holding the needle driver, sir, when we approximate the needle through one of the edges of the wound,
Okay.
should we take out whole of the needle through one edge and then insert it again on the other edge of the wound, or in a single
Yeah.
insertion we should?
Again, that's a really good question. So to start with, in the beginning, I always teach do one end first, take out, and do the other end. Okay, that's how I will teach, because you need to correct your technique of insertion and all. So it's always better to insert at one end, come out, and do it. So once you're confident with your technique, like you know that you're doing it right, then like the right length entering and right like exiting, so you're very confident, then in one go you can come out. So ideally that's what you should aim. Once your technique is correct, because that will save a lot of time, you can switch it fast. So one, because initially if you take from one edge, take it out, again insert in the other edge, it takes time. So but it's good for practicing initially. So once you're confident, you can take it just like this. See like what I'm doing. So right now how I do is just enter, come out, because I know the length which I'm coming out. See, I'm just come out just like that. In one go, I will come out like that. Okay. I hope it's clear, Anuj.
Yeah, yes, sir, it's clear now.
Yeah.
Okay, so thank you, Anuj. Sir, we have another one question in
Yeah.
the chat box. So, what should be the distance from the wound to the first needle insertion point
Yeah.
from 10B?
Yes. So it should be between 5 millimeter to 1 centimeter max, not beyond 1 centimeter. So with it should be within 1 centimeter. So how much you're entering shouldn't be too close also. So how much you're entering, the same distance. So it's between 5 millimeter and 1 centimeter. The same distance you should be exiting from the opposite side. What happens if the distance is not equal is the tension won't be equally distributed between two ends of the wound. So it will be unequally distributed, and there will be more tension, and there will be more scarring. Scar will be there anyways, but our idea is to reduce the scar. So to reduce the tension on the suture line, less the scar is. So that's a key concept.
I hope that answers your question, Tanvi. Thank you, sir. That was very insightful. We can continue.
Okay, so if everyone has finished doing that, we can move ahead with the mattress sutures.
Okay, so I think we have more questions from
Yeah, please.
Apiksha.
Sir, when we are
Yes.
squaring a knot,
Yeah.
you always moved like in, or we took three throws. So
Yeah.
the direction of your movement of squaring was always opposite.
Yes.
So if it is done at the same side, does it loosen the knot, or is it not right to do it in a particular way?
Yeah, I'll just show you. What do you mean by a square knot is that? See, can you see this? Can you see this thread?
Yes, sir.
So you can see this throw. So
Yes.
this is called a square knot. Okay. So if you don't do it in the right way, it will become like this,
Hmm.
the knot. Because only the square knot will help you. So our idea is to do a reef knot. Reef knot or the surgeon's knot is what we intend to tie. So that is too much into the suturing thing, but you just need to know that we are aiming at a surgeon's knot or reef knot. So for that, to get that, we need to square it. So this is how a squared throw suture looks like, the square knot. So while taking the tie. This is a magnified view so that you can understand. That's why I took this thread. So while first after taking the first two throws, if you tie it up, you can see this in your suture. You can just try it now. You'll get this alignment. You need to get this,
Okay,
and
so
this
the eight type structure is visible. Like when we are tying,
yeah.
when we are placing the knot, we can see like a eight is forming. Like
Yeah,
in
like this. You need to
yes.
get like this. Then only it will be tight. Otherwise, what happens is it will be loose. It's called a granny's knot.
Okay.
So what we're aiming is at reef knot or surgeon's knot. So if you're not getting a reef knot, the reef knot is tight. It won't, and surgeon's knot is tight. It won't get loose. But if you're tying a granny's knot, it'll become eventually loose. So after suturing the skin, if you're not tying the knot properly, it'll become loose. And the more complicated thing is like if you're, when the hand knots you're putting for a, the bleeding vessel, if you're not putting it tight, if you're putting a granny's knot, and eventually it become loose and it will rebleed. So you need to know your knots and you need to place it correctly. So this is the key concept. Like I'm sure like while you're tying the second throw, you'll see this.
Yes, sir. So okay.
Yeah. So this is how you need to get it.
Thank you.
I'll teach you the surgeon's knot with the hand sutures. I'll show you that. So can we
Okay,
move ahead with the matter? Yeah, another question, please. Yeah.
we have another question from Aditi. Aditi,
Yeah.
can you go ahead, please?
Hello, sir. Good evening.
Good evening.
Sir, I had a question whether the edges of the wound should be completely approximated with every intermittent suture, or there should be a gap present
No,
between
no,
them.
there shouldn't be a gap. They should be approximated. Only those two, the deepithelialized surfaces should be approximated. Then only it will heal.
Okay.
In this demonstration material, this because it's silicon, it's difficult to get it approximated because it's a bit elastic. That's why it's not getting approximated. So, I mean, in
Okay.
real life, when real tissue, live tissue, you'll be able to approximate it easily. There won't be any issue. So that's when. So if you're not able to approximate with a simple suture, especially if you have a wound over the back or the shoulder where the skin is really thick, and
Yes.
the thick skin you won't be able to do a simple suture because it won't hold. The skin is thick, the tension on the suture line is more. So that's where you need to do a mattress suture, which I'm going to teach next. So
Okay, sir.
simple suture, you have to approximate it. It shouldn't be too tight, it shouldn't be too loose, it should be just right. Okay,
Okay, sir.
the tension on the
Thank you.
suture line should be just right. Then only you'll get a good scar. I told you, right? Like anyone can suture. If you only ask a layman, they also know how to suture. But the right technique is the best thing because as surgeons, we need to give them the slightest scar. Otherwise, they're gonna remember you for their lifetime. Okay.
Okay, sir.
so
Thank
so
you.
yeah.
Okay, I think that's what we have for now. Can we proceed, everyone? You can react.
Okay.
Okay, I think we can proceed. Yes.
Okay. So the next suture, which I'm going to teach you, is the mattress suture. Mattress suture can be divided into vertical mattress and horizontal mattress. Mattress I just explained we use for wound with larger gaping or wound over thicker skin like over the back or the scalp, all those things, to get a better approximation. And you need a even with two layer sutures. It's called mattress sutures, which we are gonna do now. So vertical mattress, it's called the far near suture. I'll just draw it here. I hope it's visible. So we take four throws. It's called far near bites. So the first throw we enter from here. We exit at the equidistance from the wound edge. Again, we so this is a far bites, and the other one is the same side. We reverse the needle. We enter from here again. It's a near bite and one more near bite, and we exit from here and the knot will be on the side we started. So is it far, near bites? Is that clear? Is it visible? I'm not sure. Okay, I'll just demonstrate it. Again, hold the needle holder at the 2/3, 1/3 junction of the needle. Okay, enter perpendicularly. Again, enter perpendicularly. Exit through the wound. Just twist your wrist. Hold the needle with the forceps take it out. So that's the first row, first entry. That's a far bite. Okay, now I'm gonna enter again equidistant from the suture edge, from the wound edge, sorry. Okay, I've exited through that. Okay, the step is almost same as a simple suture. Okay, so two far bites are over. So pull the thread again, leave only a little bit. Now the next part is you need to reverse, you need to take a backhand drive. So hold the needle, so align it in this way. Now you're gonna enter back, gonna drive it back. So till now we are doing a forehand bites like this. Now we are gonna reverse it. Okay, so again, as I've shown you, so this is the near bites we are gonna take. Far, now we're gonna take two near bites. All should be in the same line. It's in a vertical same line, we're going to take it. Okay, so again we're going to enter perpendicularly. This bite is close to the skin, not too close, not too far, but just close to the skin. Enter perpendicularly, come out. Again, the next near bite in the same line. Have to come out in the same line. Okay, I've completed 4 entries, 2 far bites and 2 near bites. Okay, so now what I'm going to do is, now it's the same again. Stay inside the V, loosen up this end, take 2 throws, grasp the short end, again square it. Okay, so I'm gonna square it. So this is the first throw. See how tight it is? Again, stay inside the V, single throw, square it. Again, stay inside the V, single throw, square it. And the knot will be on the side where you have started, and cut the thread. Is it clear? Any doubts? So remember, it's a far, near bites. So enter from a distance from the wound edge, exit at the same distance, be 1 centimeter, exit at the same distance, 1 centimeter from the wound edge on one side, 1 centimeter from the wound edge on the other side. Again, two near, that is a far bites. Again, turn your needle, backhand, and enter 2 near bites. How to remove the old sutures? Okay, I'll just show you. Okay, I can. How to remove the previous sutures with the forceps? You can lift it up and take your. Once you lift it up, we can see a loop inside, and with the scissors, you can just cut it. That's how you remove the previous suture. Someone has asked that now. So is this concept clear? The far. I'll show you. The far, near bites. So everything is in the same line. So this is called the vertical mattress suture.
So could you please check my mattress sutures once, sir?
Is it Amukta?
Yes, sir.
Amukta, okay. Just lift up the threads. Let me see. Is it not getting tighter? The knots? Are you not able to tighten it? Because mattress usually, can you do it once again?
Mukta, can you please do it once again?
Yes, I'm doing it once again.
Yeah.
Okay.
So I've
Yeah.
demonstrated it here. It's like the far, near bites. 4 entries. Everything on the same line. picture your again. You were crossing your hand. Yeah, don't cross your hand. So once you take it, no, instead of going like this, just turn it like this. You should never cross hands in surgery. So you're doing this. So once you tied it up, just like this. This is how you square it. This movement, rather than doing this. Yeah,
This,
Amukta. Yeah. This is the same. Yeah, you can cut it.
yes, sir. Thanks.
Anuj, you have done it.
Yes, sir. Can you please have a look at what I've done?
Yeah, can you just show me? Can you just lift it up?
So these are the two mattress switches that I've made.
Okay,
So,
okay. Can you
so
bring it to the center of the screen? I'm not able to see it.
is it
Ah,
visible?
yes. Yeah, that's perfect, Anuj. That's good.
Yes, sir. I wanted to ask one thing. Yes, sir,
Yep.
in one of the switches that I've made first, I couldn't see any suture material on the left side. That is where the knot is not present. But
Yeah.
on the second suture that I've made, I can see if you can see this black suture thread
Huh.
on the side where the knot is not present. I mean, is this a faulty technique? Why I
No,
am sure?
no, because the distance from, the wound entry site, how much the distance between the distant bite and the near bite, if it's more, you'll be seeing, say, suppose you look at this in my thing, it's equidistance, right? So if the distance from your other ends, far end and near end is more, you'll be able to see a small thread outside.
Okay,
If it's equidistance, you shouldn't be seeing it. Understood. So the more the distance between the far end and the near bite, you will see a bit of suture outside. So that's okay.
okay,
It's not faulty. The only thing is, whatever distance you take at one end, the same distance you should take it on the opposite side. That's it.
okay. Thank you, sir.
It shouldn't be too far, like shouldn't be beyond like 2 centimeter and all. So there will be more attention on the suture line.
Okay, sir.
They've done it right. I will just let you show.
So this is Lakshita, right?
Yes, sir. This
Lakshita,
is
yeah.
this one is the one. The last one, sir.
Mm, I can't see any thread outside. Have you cut it too short?
Uh, this one.
Uh, okay. Can you just bring it to the center? I'm not able to see.
Now?
Yeah. I think you have cut it too short. You can leave a little more thread outside because we need a bit length for removing the suture. When the patient comes back to you after 1 week, you need to remove the sutures, right? So
Oh,
in
yes, sir.
in order to remove the sutures, see how I'll just show you how to remove also. So that we can finish with that. So how we remove is, so catch hold of one end. You have a loop outside, right? Catch hold of one end and see how I'm catching. So you need some thread outside to catch it. And once you lift, you can see a loop inside. So put your scissors inside and cut that loop. Once you cut that loop, you can just pull it out like this. So this is how it. So this is how the suture should look like once you, because you have to take it in toto completely. You shouldn't, keep any remnant sutures within the skin. So once a wound is healed, you need to just, so for that you need some end outside the skin to catch hold of it. The more the shorter, you will struggle to remove it. Yeah. Otherwise, it's good. It's well approximated.
So one more thing, when I'm trying to knot the suture, like with
Mhm.
using the square knot, my knot keeps slipping out, like it's moving to the side rather than the place where it's supposed to be, especially in simple interrupted sutures, sir.
Yeah, this is because this property of the silicone material, this issue in everywhere the practice material, it's like that. You won't get a near life feel because silicone material, it has an elastic property, so it's difficult to approximate. It's usually like that. Don't worry, but it's way easier to you just get your technique right, and it's way easier to suture in live tissue.
Okay, sir. Thank you, sir.
Okay, yeah, because if you're placing the right knot, yes, it will stay in place. But if you're placing a granny's knot, yes, it will loosen up, even in live tissue.
So these are the mattress sutures that I did.
I can see a picture. Can you bring it to the center? Okay. In mattress, yeah, you need to drive the the knot towards one side.
Yes,
Yeah, it's on one side, right? The knot.
sir.
Yes, yes, yeah, that's good. So it should be equidistant. Okay. So this concept is clear, right? What I've shown. This far, far, near, near. So this is the concept of vertical mattress. Okay, these are the entry points. Okay. Shall we move ahead with the horizontal mattress?
So can I show you my sutures I made?
Mano, who is this? I can't see.
Yes, sir. Aditi, sir.
Yeah, please
Yeah,
share your
sir.
screen. Yeah, please show me the switcher pad. Yeah.
Yes. So am I visible?
Yeah, can you just bring it to the center? Uh, okay. You need to, cut the ends at with equidistant. Okay. Both ends should. I think one end is a bit. The thread is a bit longer. Otherwise, it's fine.
So,
Can you please take a look at my sutures?
Yeah. Who's this?
Kushagra.
Okay. Can you share your screen? Yeah. Can you bring it a little more closer? Yeah. Yeah. That's good. That's fine. Both threads are equal length, right? The outside
Yes, sir.
threads. Yeah.
Yes, sir.
Yeah. That's good. That's good. So shall we move ahead to the next future? So the next one is the horizontal mattress. So
Sir, we
here,
have a question
yeah,
from
please. Yeah.
Apiksha. Please go ahead.
sir, when we are taking the near bite,
Yeah.
should it be via the edge of the wound, or it should be just closer to the edge and not via through the edge?
Not through the edge because it will cut through. So once you
Okay, sir.
tighten it, it will cut through. It should be close to the edge.
Okay, sir. Thank you.
And it shouldn't be too deep also.
So it should be superficial to the far, superficial as
Yeah.
compared to far
Yeah.
bite,
Yeah.
but closer to the edge.
Exactly. Exactly. Okay. Otherwise, what happens is if it's far from the skin edge, what happens is the skin will get inverted. If the skin is inverted, it won't, heal properly. Skin should be properly everted. So it shouldn't get inverted. The skin edges should be properly everted, everted and approximated. Then only it will heal properly. The dermis is when it's where it should be, in contact with each other, not the epidermis. Because epidermis won't join. It's the dermal part which is, getting joined and epithelializing, and the scar will be forming there.
Yes. Thank you, sir.
Yeah. So the next one, what we're going to learn is horizontal mattress. So the same thing, horizontal also has four bites, but not in the same line. So I'll show you the horizontal mattress again. So all the bites are equidistant. So we enter from here, we exit from here. Again, turn the needle. Instead of going back in the same line, just come down or go up, equidistant. We take a entry bite and come out of here. Again, 4 bites. This is not the far, near bites. All bites are far and not in the same line. I'll just demonstrate it. So we enter at a distance from the wound, come out through the incision. Again, hold at 2/3, 1/3 junction. Through the wound, I'll come out through at the far bite. Okay, so this much I know you guys are sure. So in vertical, what we did is in the same line we went back. Okay, It was a far bite is over. We went for the near bites. So in horizontal mattress, what we do is we enter at the same distance. The same distance we have to enter from here, the same side, backhand, come out through the wound edge. Again, take a far bite. This again a backhand bite. Okay. So two far bites. Enter here, come out of the opposite side as a far exit. Again, enter far, not near. So it's in two different lines. It's called a horizontal mattress. So you can see the thread outside joining these two. So next the concept is the same. Stay inside this V, take two throws, catch the short end, square it. See how the wound is getting approximated. Just have a look. So this is how it get approximated. And again, stay inside the V, square it, second throw. Stay inside the V, catch the short tip, square it. Okay, so this is how a horizontal mattress looks like. So the horizontal mattress, we use you'll be able to close the switch line really fast because it's equivalent to two interrupted sutures. You can see two threads outside just like this. So the vertical is more cosmetic and less tension on the wound. Even if you don't practice horizontal mattress much, it'll be fine. But vertical mattress, you need to know. Okay, horizontal will help in closing the tissues really fast. So that's only advantage. Yep. I hope it's clear.
Thank you, sir. Any more questions? Okay, can we all turn on our cameras so that the surgeon can comment? Okay, thank you. We can proceed, sir.
Yep.
Sir, I have tried to do the horizontal.
Yeah, I can see that. I can see that. See how you need to align this. It should be in the straight line. See, it should be a
Yes.
straight line. You can see yours is a bit. That's okay. That's perfectly fine. First time it will be like that only. That's why it's why because these two entry exit points should be in a single line.
Yes, sir.
You understood. So it should this one and this point should be at the same line, parallel to the wound line. Okay, parallel to the wound line, equidistant from the suture, I mean the incision line.
Yes, sir. Understood.
I hope it's clear. Yeah. So once it's equidistant, the thing will come as straight. So other one, the issue, I mean, the first knot which you have tied, it was in straight line. The other one, I think I mean, the second entry was a bit more far than the first entry. That's why. That's not a problem. You can correct it with practice.
Yes, sir. Thanks.
Yeah, and it should be tight. It should be tight like this. The edges should be approximated. Okay.
Understood, sir. Yes, sir.
Yeah, yeah.
Second, please have a look on mine also.
Yeah, Anuj, can you just show it?
So the third one suture. This one. Is it visible, sir?
Uh,
This one.
third one. Okay. Okay. Yeah.
So
Yeah. That's
one,
fine.
two,
Yeah.
three.
Yeah. That's fine. That's fine. Good.
So one more thing I would like
Sir,
to
can you
ask.
see the
Yeah, Anush, please.
So when I try to hold the needle from the two-third, one-third margin, sir. So
Hmm.
when I try to change the direction of the needle, going from far to another, like reversing the direction, I
Yeah.
usually I usually slip off the needle through my needle catch. So what should I improve to hold the needle
Can you just
correctly?
show me how do you do it?
Yes, sir, sure. So am I visible now, sir?
Yeah. Yeah.
Sir, at this point of time, when I try to
Hmm.
gain access to the other side of the wound, I usually
Yeah.
slip off my this needle.
That's
Like,
okay. That this takes practice, Anuj. Yeah, it's just what this thing, you can't just master in, first or the second time. It'll take practice. That's how it is. Even I was like that at the beginning. So once you practice more, you will be able to gain good control of the backhand drive. It's called the backhand drive. So
sir,
you will master it. Don't worry. You will do it better. Like if you practice 3 4 times, the fifth time definitely you'll be better. You'll be able to gain good control because backhand we are not used to. No? So backhand, the forehand drive is much easier. The backhand you need to gain control. So the more you practice, the more you get control. So you can exit at the point where you want. So till then
yes,
you need to practice. You'll get it. Only need to just correct your technique. Concentrate on your technique first. So as soon as you get the technique, concentrate on the speed. And the more you practice, the more you will get the technique. It requires practice.
sir.
But you guys are doing great, actually. You guys are really good, fast learners. I should appreciate that.
So this one I have made right now. Is it right, sir?
Can you
The
just show me
fourth one.
can you bring it to the center? Yeah,
So the
yeah,
fourth one. This is third,
yes,
this is fourth.
yes, yes. Yeah, that's good.
Thank you, sir.
Again, I'll show you how to remove this. So catch hold of one edge of the thread. You can see a V loop outside, right? Above the knot. So catch hold of one side of the thread. Usually for removing the sutures, we use mosquitoes in one hand to grasp the one end of the suture. With a mosquito, we grasp and we pull it up so that we can see an inverted V just popping out of the skin. Is it visible? Can you see a inverted V here inside? It's a loop actually, which will come out when we pull up. So just insert your scissors into the loop. Is it clear? Am I clear? Are you able to see? Yeah, can someone respond? Are you able to see? Okay, yeah, just insert the scissor into this loop and cut one length. Okay, then with the mosquito, just okay, it has cut through. The mosquito, you need to just pull it out. Okay, it'll just come like this. Okay, so that's how you remove a horizontal mattress suture. If done, we can move ahead with the next suture. That is the continuous suture. Shall we?
Yes, we can proceed.
Yeah. So the continuous suture we basically use for the subcutaneous tissue. So in this practice material is difficult to demonstrate in the subcutaneous tissue. So I'll just show you the continuous suture which we use for the skin. Okay. So again, start from one end. Okay, start from one end, perpendicular, take it out, or you can go in at a single throw, exit at the other end. Okay, come out, stay inside the V, long end, short end, take two throws, square it, again stay inside the V, single throw, square it, stay inside the V, single throw, square it. So here we are not going to cut the two threads. We have one short end and one long thread. I'm going to cut only the short one because I'm going to take a continuous bite. So next, at equidistance, we run the suture, equal distance from two edges. Okay. So that's the first throw. Again, same distance here. And perpendicularly twist your wrist. You can take it in single go. You don't have to, like, I think you guys can do it now. So again, equidistant. Are you able to follow? I hope so. So it's pretty easy. Just run it continuously. Okay. So you have reached the other end of the wound. So here you need to loop it. So you've taken your last throw. So what you can do is, so this is a loop. So you need to put a knot at this end. Okay. So the other end we have tied, this end we need to put a knot. So use a loose end. Okay. Take a loop, hold the needle, take a loop, hold, uh, take a loop and hold this end of the loop, other end of the loop, and square it just like that. Okay. So my thread is small, that's why I'm struggling. Okay, again, take a loop and square it. Okay, and you can cut this end. So that's how you finish a continuous suture. Okay, you can use it to close by using hernias and all. We use it to close a fascia. Fascia of external oblique upper neurosis, we close like a continuous suture. So you can do this continuous suturing. Tie the knot at one end, other end, you loop it. So there's a loop at the other end. That's how you do the continuous suture. Any doubts in this? We can practice this now.
So one small question.
Yeah.
So when you're taking the continuous suture bite, do you take two bites consecutively or one bite at a time? Then you do in a zigzag.
That's what I said. To begin with, you can take two sides. I mean, you can take two sides separately to get your technique right. Because initially you need to concentrate on the distance from where you enter from the suture line, for the incision line. Sorry. So initially, you can take one by one. Like you concentrate on the entry first. Enter from one side, come out, and enter again from inside out. So, but once you've practiced, like once you know the distance, once you're aware of the distance, then you can take it in a single go and you can save time. This comes with practice. You will get it. So
Okay, sir.
initially,
And how much
yeah,
depth
tell me.
should we take for the suture?
Not too deep, not too deep. It is just skin approximation. Basically, we don't use this for the skin. Ideally, we use it for
The
the
subcutaneous
subcutaneous
tissue.
tissue and for the fascia. So this is where the continuous sutures we use. Usually for the skin, we use simple interrupted or vertical mattress or horizontal mattress. Skin, hardly we use this continuous sutures. It's difficult to demonstrate it, inside. That's why I'm showing. In subcutaneous, like if I can show you, it's subcutaneous means like you have to invert it, take a bite inside. Can you see?
Yes, sir.
Yeah, take a bite inside like this, come out again, invert it, you know, the subcutaneous tissue we take. So you have to remain in the subcutaneous tissue. We have to take the dermis and the subcutaneous fat. That's where we have to stay. While if you're doing this in the subcutaneous layer, this won't be seen outside. It's completely inside.
Inside.
You understood? So I mean, I am
Yes.
not sure whether if I demonstrate it here, whether you'll be able to see it. So this is how you take
Yes, sir.
the
I'm able to.
Yeah, so this is how you take the subcutaneous continuous sutures.
Okay, sir. Thanks.
Yeah,
Excuse me, sir. Sir,
yeah,
are my continuous sutures visible? Like,
yeah. It's visible. It's in a bit on zigzag because you have entered at different points. So it should be equidistant. So that'll comes with practice. Don't worry.
okay,
So
sir.
if you can see mine, it's not very symmetrical, but still almost on the same line. You can see it's in the same direction. So
Yes.
yeah, it's like that. Comes with practice. So you enter at one point, at the same distance you exit. Enter the same point, equidistant. All these two, the distance between these two bytes should be equidistant.
Understood, sir. Yes.
Yeah. And you need to loop it at one end, tie it at one end, and the other end you need to loop it.
Sir, actually, I had a smaller thread, so I could not like.
Yeah, it's difficult. Yes, once the thread is small, it's really difficult to switch. I understood. Yeah.
Thanks.
So I'll just show you how to take the subcutaneous one. So I've shown the throw. So again, stay inside the V. Take a loop. So again,
Sir, there was
yeah,
a question there.
yeah.
So we asked if you can demonstrate the continuous suturing technique again.
The skin. Okay, yeah, I'll do it.
Okay, thank you.
So again, I'll do in this. Can you hope I'm see? So this is the wound edge. So end up perpendicularly at one end, come out at equidistance from the other end, twist your wrist, you come out there. Okay, pull the thread till a short thread remains on the other end. So this is a V, stay inside the V, loop around, square it, again loop around, square it. Sorry, loop around, square it. So I'm gonna cut the shorter thread. Okay. Now I have anchored the suture there. Now I'm going to take continuous bites. So again, I'll enter at a distance depending on the width of the wound. It should be 5 millimeter to 1 centimeter is fine. Enter perpendicularly. You can take out in a single go. Okay, the same distance we have entered from the wound edge, the same distance we have to exit and twist your wrist. Okay, take it out. One second, got looped. Okay, again, the same distance, again, come out, Okay. Enter perpendicularly and come out. Again, enter perpendicularly, come out at the same distance. Okay. Come out of the same distance. The length should be the same. That's when you get the good approximation. I'm going to take a wider bites to demonstrate it fast. So that's going to be the last bite. I'm going to loop it. We can all have a look at how I loop. So the last bite, last throw, you shouldn't pull it out completely. So just leave a loop like this. Okay. So this is a loop. Okay. So again, treat it as a V. So I take 2 throws from this end, and with the tip of the needle driver, I'll catch hold of the tip of this loop. I'll show it once again. So there's a loop which I've left it behind. So there's a longer thread. I wind it around, catch hold of the tip, catch hold of the tip of the loop, and I'll just pull my left hand, the longer thread, so that the knot will come out through the loop. See? So I pull it. I'll show once again. Wind it around. With the needle driver, I catch hold of the tip of the loop. I'll just pull the left hand. So you need to just pull it so that in the right hand you have the loop and the left hand you have the long thread. And just tighten it. Okay. Just tighten it. And next throw, catch hold of the tip of the loop again. Pull your left hand. Second throw. Again, one more. Catch hold of the loop. Okay, so this is how it looks like. And you can cut this edge, this end, this thread, you can cut it. So this is how it looks like. You have a loop at one end, other end you have anchored. So this is how a continuous suture looks like. Okay. This end you have the loop. You have the loop at this end, and this end you have anchored it. And this should be equidistant from each other. Okay. I hope you can see that, the loop. There's a loop. Is that clear? Got any doubts with that? If it's clear, then we can move on to the last suturing technique, that is subcuticular technique, and which is the most artistic form of suture.
So
Subcuticular sutures will give you the least scar. The sutures will be inside the wound. No sutures will be seen outside. So that's subcuticular suture. So once you're mastered this, we can move ahead with that. And after that, I'll show you the hand knot techniques. With that, we'll close the session. So if you're ready, we can move ahead.
Thank you. Apiksha, do you want to ask a question?
yes, so we can cut the loop right at the end.
For removing or
No, while when we are closing, when you took the knot.
No,
is
I
it
didn't cut the loop.
okay?
I cut the long thread, the other thread.
Okay,
You
so
can
we have
see
to keep the loop
the
intact.
you can see this loop is still here. Can you see?
Okay. Yes, sir.
Yeah, the loop is intact. And this is the thread. This is a long thread which I've cut. See this one.
Yes.
So I had cut the long thread here. I kept the loop there.
Okay. So actually, I cut the loop as well. I don't know if you're able to see.
Yeah. That's okay. But the thing is, you need to keep the loop because then only you'll be able to remove it smoothly.
Okay, sir. Okay.
Yeah. Because when we are suturing in subcutaneous region, you will cut the loop because in subcutaneous tissue, we won't keep the loop.
Okay, sir. No.
Give me a minute. I'll just come. Yeah. So can we move ahead? Any doubts?
Yes, we can proceed.
Yeah. So the next technique which I'm gonna teach you is the subcuticular. So in the subcuticular sutures, what we do is we run the suture material through the subcuticular space. Cuticle means skin. It is just beneath the skin. Through the dermal layer, we'll be running the sutures in parallel. Okay, so that once we close, we won't be seeing any sutures outside. So that's how we close the subcuticular. For that, so this is how you enter in subcuticular. Okay, uh, so this is the corner of this wound. So I'm gonna enter from the corner, perpendicular. Okay, enter from the corner. Take a thin wound in this silicone pad so that you can approximate the subcutaneous tissue well. So you enter from the corner, a bit distant from the corner, and exit right at the corner. Okay. See, I'm entering at a distance of 5 millimeter to 1 centimeter from the uh, corner of the wound. I'm entering right at the corner. Okay. So that's the first entry. I'm gonna run my suture in the subcuticular layer. You need to put a mosquito over that so that it will be a bit taut. Okay, now I'm gonna run my sutures in the subcuticular layer. For that, we have to evert the skin first. Just stay parallel, very much parallel to the skin edge. And you have to enter parallelly. Okay, it shouldn't be in the subcutaneous tissue and it shouldn't be in the skin. It should be in the dermal layer. You have to run a parallel bite. Okay, so you've taken the first bite, come out, and opposite side you have to enter, you have to cover the same segment, because now I've covered this segment on this side, subcuticular. And now I'm gonna enter here and cover the same distance here. After that, I'll take a bite covering this length in the subcuticular layer, then here. After that, here, then here, then this length, this length, this length, and this one. Are you able to see the length I'm going to cover? So this much length I've covered in the subcuticular layer. I'm going to take a bite here. After that, here, I'll just show you how. So the next bite, that length I'm gonna cover in the subcuticular layer, just like this. See? So you won't be able to see my suture outside. So now I'm gonna evert the skin. And again, this side, I'm gonna cover the length which I've drawn outside. Okay. So it's kind of a zigzag. And here, and this side again, I'm gonna come back and cover this segment. So once I approximate, see, I'm gonna approximate the part which I've done. See, you won't see any sutures outside. Both ends are getting approximated. Are you able to follow?
So could you please show this once again, sir? Like where to enter after the point?
The entry point. Okay, yeah. Then I'll pull this out. I mean, the entry, the initial entry, or like how to take the bites, subcuticular bites.
Like sir, from the bites part, sir. Like after entering from that edge.
Yeah. So after entering from that edge, first bite you cover this segment first. You'll take segment by segment. First this segment, then this one, then this segment, and after that cover this segment. So are you able to see?
Yes, sir, I can see.
Yeah, I'll just show you how you cover it. So I'm going to cover this segment next. So the same thing only, you can do it. So my suture is here actually. I finished this segment and now I'm going to do this. So I'm going to do this is evert the skin. I'm just beneath the skin in the subcuticular layer. The same length I'm covering. This needle is in the subcuticular layer, not in the skin. Are you able to see?
Yes, sir, I can see, sir.
Yeah. So I'm going to take it out. So that segment I've covered in the subcuticular. Okay. And then I'm going to go to the opposite side and cover the same length. See, I entered here, finished this. Now I have to cover this segment. So I'm not going to enter here because I have to cover this. So I go back and enter and cover that segment in the subcuticular layer. Are you able to follow this?
Yes, understood, sir.
Yeah. So I pull it out. So you can see a zigzag inside. That's how it should come. Can you see the suture inside? Is
Yes,
it clear?
sir.
Yeah.
Yes, sir, yes, sir, it's clear, sir.
Again, now I'm gonna cover the next segment ahead. That is this one, this segment. After that, this segment I'm gonna cover. So how I'm gonna enter is again this segment I'm gonna enter in the subcuticular layer. See, I've entered in the subcuticular layer. I'm gonna come out and go back and enter and cover this segment. Okay, in the subcuticular layer again. So it's just beneath the skin in the dermis, subcuticular. See, so if I pull this thread, see, it's all well approximated from inside. You won't be able to see any sutures outside. It's all inside. Then at the end, we'll take a loop at both ends. I'll show you that. So I'll cover one more and we'll enter it. So this edge I finished. And the last subcuticular. You need to invert the skin. Then only you will be able to do it better. So you finish the entire length. Then this is the corner of the wound. Enter through that and exit at a distance of 1 centimeter. So the how you entered here, you entered from a distance of 1 centimeter and exited through the wound edge here. Here we are going to exit through the wound edge and exit at 1 centimeter. Okay, then again we need to take a loop. So once you are thorough with this, I'll teach you how to take the loop outside. That's a different technique. So you pull at both ends. It's well approximated. So that's how you do it. And taking the loop, I'll show you. So this end. So you need to take a loop with the sole thread alone. Okay. So keep it lax. Wind it around the needle driver, and with the tip, you catch hold of this thread after the exit. I will show once again. So this is a loop. Yeah. So this is the loop what we are seeing. Wind it around. And this thread you can see, right? The other end of the loop. So catch hold of the thread a bit close to the exit side. And again, pull the left hand so that the loop will slide and form a knot. Once again, wind it, catch hold of the, now there's a proper loop, catch the tip, pull the left hand, and a knot is formed. The same way, you can take it at this end. Wind it around, catch the tip of the thread. You can see the loop sliding. This is a loop, it's gonna slide. When I'm pulling my left hand, it's gonna slide just like that. And the loop is formed there. Again, take it through, catch the tip of the loop, it's gonna slide it. Once again, take it through, catch the tip of the loop, it's gonna slide it. And you can cut it here. Here too. So you have two loops outside, one here, and none of the sutures are visible there. So it's well approximated. You can see that. So that's how you tie a subcuticular suture. Is it clear? It's a little bit difficult to follow, but with practice you can do it.
Sir, can you see these one?
Yeah, can you just show me 1 second?
Sir, is it visible?
Yeah, you're finished, right?
Yes, sir. This
No, that's
one.
great. Yeah, that's great. That's good. Well,
Sir, I
well
feel
approximated.
when I'm looking closely,
Yeah,
at some places the approximation is good. Like at one place, I can still see a gap here. I don't know
yeah,
if you can
yeah,
appreciate.
yeah. That's okay. That's perfectly fine. That's okay. When you start initially, that's how it is. So what you need to know is, so first you cover this segment. Once you cover this segment, and you need to go back and the next segment you need to cover at the same distance. So all these segments should be equidistant. So if one of your segment is, I'll just show you, if one of your segment is this much length and your other segment is this lengthy, you see the approximation won't be good.
Okay, understood.
So it should be equal length. If you're covering this much segment, you need to go back and enter at the same spot. So you entered here, then you once you exit here, come back to the same line, enter here, and finish the same length. Rather than entering here, going back at the same line and exiting at a farther place. So then that gives a zigzag approximation.
Understood.
More zigzag, the tension won't be equally distributed. So that's when the gap happens. If these distance is not equal, there will be a gap. Even see, my wound had a gap. The distance was not equal, but all other areas it's equal. Here it was not equal because in between the length was not good enough. So there's a limitation with taking in this, but in real life tissues, it'll be much easier for you. You understood? So the gap is because this distance is not equal.
So what should be the distance we should cover while we are taking the throw?
5 millimeter. 5 millimeter is the best one. More than 5 millimeter, there's a chance that you might, if you take more lengthier bites. Like if you keep this as more than 1 centimeter, 1 centimeter or so, what happens is there's a chance that there's a gap. So take 5 millimeter bites.
Okay, understood. Thank you.
Yeah.
Okay, thank you, sir. So there is one question
Yeah.
in the chat box. So Anuj is asking if you can demonstrate that once again.
Which the subcuticular.
Yeah.
Okay. Yeah.
Excuse me, sir. So could you please check if this is okay, sir, the subcuticular one? Like when I'm approximating it, like it's getting it in. So
Which one can you show me?
this one, sir.
Can you get the camera there? Your camera is towards the side. Was your loop outside?
The loop outside. This one is outside, sir. Rest all are inside, sir. The loop is coming outside.
No, there should be two loops.
Two loops. The second one. How
Oh
should I
yeah,
do it?
yeah. Okay. Yeah. So this one, the entry loop, it's a bit far from the wound edge. If you can see here,
Yes,
this
sir.
length in your suturing is a bit far. You have entered here, so you don't have to enter that far. You can keep it close.
Understood,
Okay.
sir.
Yeah. The other ones, your sutures are visible outside because you have taken bites outside. None of the sutures should be visible in the suture line. Can you see that?
Yes, sir. Understood, sir.
Yeah, so you need to stay. I'll just show you again. You need to stay beneath the skin. That's why it's called subcuticular. It is beneath the skin layer. I'll just show once again. So we are going to enter at 5 millimeter to 1 centimeter from the wound edge and enter right at the angle of the wound. Okay. See, then what I'm going to do is I invert it. I'll draw it again. I'm going to cover this segment with that length followed by the segment. Okay. So invert it. This entry should be below the skin and parallel to the skin. Uh, I don't know. Can you see how I drive my needle? Can you see it? Is it clear? I'll just bring it. It is beneath the skin layer. See, it is not at the skin. I'm inverting it now. Is it clear?
Yes, sir. It is clear, sir.
Yeah. So it's beneath the skin. I took the first bite. Okay. So now I'm gonna take the same distance at the opposite side. Okay. So this is opposite side. Now I'm gonna cover this length again. So see what I said? Wherever you entered, enter at the same spot, same side from the opposite side also, and cover the same length. See, I've covered the same length and I'm coming out. Okay. And I'm going to take the next bite. I'm going to cover the next segment. So this is a segment I'm going to cover next, close to that. Okay, the marker is not working. This length is I'm going to cover. Because this length, wherever I've exited from, you can see I exited from here. That same line I'm going to enter at the opposite side. So that's a technique. I'm going to invert it, enter at the same line where I've exited from the opposite side, grasp the needle again. I'm going to cover the opposite side now, invert it. The same subcuticular level I'm going to enter and cover it. Okay. So, and just try to pull it. See, it's approximating. So that's how it should be. And run it across the same length. Okay, you can again in the subcuticular layer, go inside Evert it. Go inside, come out. Okay. Again, evert it. So once you know the length what you're taking, you don't need any marking. You can do it in your mind. You can calculate it. You can do that. Because I know where I'm entering, where I'm exiting. So I have a calculation in my mind how much distance should I cover in the next bite. Okay, see? It's approximating well. There's no gap and you can't see any sutures outside. Are you able to follow?
Yes, sir. Understood, sir. Sir,
Yeah.
in my suture which I had shown, sir, I pulled both the sticks like from the other two ends, like a bit, making them taut, and then the sutures they all like disappeared like inside.
Yeah, can you just show me?
Yes, sir. 1 second, sir. So here, like if sir, like right now, I just pulled both the rope, both the ends at the same time, and then they became like.
I'm not able to see Amukta. 1 second. Yep.
So is it visible, sir? This one?
Yeah, but I can see a few sutures outside. I mean, maybe I'm looking at the wrong side.
This one. So I'm still trying to pull it to this one.
Oh, 1 second. 1 second. Yeah. I mean, I think your camera is not directed to the, Haha. Okay. Okay. I can see now.
Just 1 second, sir. So I'll just join from another device to show it.
Sure. Yep. So about others, have you practiced? So this is how.
Sir,
So
could you just check on my suture, sir?
yeah, can you just show me? Who's this? Lakshmi.
This one,
Yeah.
Lakshita.
Lakshita. Yeah, please.
This one, sir. The one which I'm showing.
Yeah. Can you show me the ends?
This is one of the ends. The
Yes.
not end, the last one.
Oh, you've put a loop. Good, great. Yeah, this looks perfect. Yeah, none of the sutures are visible outside. Yeah, you can finish
Yeah.
it there and take a loop at the other if you have enough length.
Yes. But my suture got over. I have to start the
Yeah,
new one.
that's okay. But this is perfect. This is good.
Yes. Sir, why does the skin pad gets lifted when I start doing the suture? Like, is it normal or?
Yeah, it's normal. It's like that only. No, it's a silicone material, so that's natural. I mean, it's a practice material only. Or
Okay, sir.
you need to put weights on both end and do it. So all practice materials are like that. It gets lifted up. That's normal only. Don't worry.
Okay, sir. Thank you, sir.
Yeah. So I think if you're clear with the suturing techniques, we can move ahead with the hand knots.
Any more questions in the room?
I think Amukta, like she wanted to show her suture. I think so.
So
She's
that
logging in from other device.
so I'm not able to log in from the device, so we can go on to the next one. Since
No. We'll clear your doubt. Don't worry. I have time. Please.
I got the doubts were cleared, sir. It is already
Clear. Okay. Fine. Any more doubts with the suturing techniques? Any of these techniques which we did so far?
Sir, if you can show the last part where you tied the knot for this.
Yeah. Sure. I'll do that. I'll just finish this one then. Yeah, I've taken a bite here.
Feel free to drop your questions in the chat box or raise your virtual hand so we can.
Yeah, I'm gonna finish this end part of the suture. 1 second. Okay, now we have taken all the edges. So the last bite is how you entered, just like that. So you entered distance of 5 millimeter, one distance from the wound edge, and enter through the wound here. So here I'm going to exit at this corner and enter at a distance of 5 millimeter. Can you see? I'll just show it again. Exit from the corner and the straight line, enter at a distance of 5 millimeter and pull it out. Again, so we're going to take a loop with this thread. So how we're going to do is, so wind it around the needle driver 2 times. Again, wind it around the needle driver 2 times. So now you have a vertical limb here. So you need with the needle driver, catch hold at one end, close to the exit side, like this. So wind it around this vertical limb, catch hold at one end. You can see now you have a loop here. You have caught hold of that thread there, and with your left hand you have a long thread. You need to just pull your left hand. You can see the loop sliding over your needle driver. Sometimes it gets tight on the needle driver. Just push it down. Just push down the knot because you have caught out on one, and you're gonna create a loop. See, you're gonna form a loop like this. Once you pull the left hand now, it's gonna get tight. Okay, you can see a loop. I'm going to pull my left hand. I'm going to tighten the loop now. Tighten the knot. See? You need to tighten it further. Again, wind it around. Now there's a well-formed loop. Catch hold of the tip. Again, slide the thread through the loop by pulling the left hand. Once again, take a throw. Catch hold of the tip of the loop. Slide it through the needle holder by pulling the left hand. And you're going to tighten it. And take your scissors and cut it a bit length of 5 millimeter. Again, you have to do the same thing at this end. My thread is short, I won't be able to do it with the short thread. So you need to be mindful with this part of the wound. So you need to leave enough length to take a loop. So here the mistake what I did is my loop length is not well enough to take a throw. So see, I'm struggling here. I won't be able to do that. I need small mosquitoes to do that. We'll be able to do it, but with only small mosquitoes. So that's how you do it. And you won't be seeing any sutures in this line. None of the suture is visible. So it's a well approximated one. So that's how it should be. And at both ends, you need to have a loop like this, like this. Okay. Is that clear?
Sir, can you please take a look at mine?
Yeah. Can you share your screen?
Yes, sir.
Kushagra. Yeah. Yeah. Can you bring it to the center? I'm not able to see. Yeah. A little more farther. Yes. This is good.
So
Well
my
done.
thread was short, so I couldn't do it on the other end.
Yes. The other end you have done it. It's perfect.
Yeah. Thank you, sir.
Yeah. So do you have the hand knot practice material with you all? So shall we move ahead with the hand knot practice?
Yes, sir.
Okay. Do you have the hand knot practice material with you, the thread?
Is
Sir.
everyone ready? Can we proceed? Yes, I think they're ready, sir. We can proceed.
Okay. Just give me a minute. I'll just set it up. 1 second. So here I'm gonna demonstrate the hand knot practice material, how to take hand knots, how to tie hand knots. I'm gonna demonstrate that. So are you ready with your materials? Please let me know once you're ready. I'll show that.
Kindly prepare your handout material so we can proceed. Is everyone ready? Can you guys give us a thumbs up?
Okay, so here I have
Yes,
this
sir. We can proceed.
this is a handout practicing board. So what you need to do is you need to, if you have a thread with you, you need to hook it around somewhere so that you have this hook motion. If you can hook it around somewhere, that's good. Okay, so take the thread. So hand knots basically we use during any surgeries instead of tying with an instrument. You can tie a vessel or tie the sutures tie the thread using this hand knots. It's easy and simple and fast than suturing with the instrument. Okay, so suppose you can see that suppose this is a vessel or something which you need to tie. So we tie the thread around the vessel. Suppose this is a vessel. So I'm gonna teach you how to tie it. Okay, so you can do with me. You can do it with me. First, you have to do is hold it in both ends of the tie. You can hold it in both hands like this. Okay, then you cross it. Cross it means just like this, and exchange your hands. That means the right side should come below. The right side thread should come below. Okay, I'll show again. So you hold two ends of the thread, cross your hands and exchange so that the right hand side thread is below the left hand one. Okay, next what you have to do is, so you observe me. What you have to do is you make a movement like this with your fingers, like this. This is what you do. Okay, so with the right hand you hold the thread like this. Okay, and with your three fingers up and put it over that thread and invert it like this. Okay, so I'll show it again. I cross my hands. So the right hand thread is below the left hand. I've held it like this with the thumb and index finger with the other three fingers up. I've kept it over the thread and inverted it. Inverted it like this. Next, you have to place the thread on your left hand across it like this. Across and fold your middle finger and take this loop, take this thread inside this loop like this. So that goes your first row. I'll show it again. It's a bit difficult to follow initially. You need to practice it. So two threads, cross your hands and cross your threads basically. Take the right hand side thread below the left hand. Hold it with your thumb and index finger with the three fingers up. Invert it. Place the left hand thread over this like this. Pull the middle finger and what you need to pull this light blue thread into this loop. That's what I'm going to do. I'm going to pull this light blue thread into this loop. Okay. For that, I'm folding my middle finger and pulling it and holding it between my ring finger and middle finger. I've got hold of it. I'm going to release my thumb and index finger. I've released it. Now my middle finger and ring finger is holding it. I'm going to take it out through that. Okay. So as I've shown you with the suture, so you're gonna form a reef knot with this. Okay, now you're gonna square it. Here also there is squaring. How I'm gonna square it? Like this. I'm gonna place it, the first knot. So this is a first row, and you have one more row. Just let me know if you have practiced the first one, then I can move ahead with the second throw. Then only a proper reef knot is formed.
So could you please show like after like crossing over the two
Yeah.
threads, like how to do the finger?
Yeah, again, so catch it between the thumb and index finger. Is it clear? This much part is clear?
Yes, sir.
Yeah, hold it like this, see? This motion. Like, yeah, superb. We say, right? You're superb. Like this. It's good. Everything is good like that. The same motion. Okay? So I'm going to hold it like this. I've extended 3 fingers. I put the 3 fingers on this thread. And I'm going to just invert it. Have you got it till here? Are you able to do this? This part?
Yes, sir. Yes, sir.
Okay. So the next step is I'm going to place the left hand thread, the dark blue thread, over the light blue here. You can do this. Have you done this till now? Is it clear? Okay. So next I'm going to fold my middle finger. So by folding the middle finger, I'm just expand. See, imagine this as a loop, this one. So this is a loop inside. So I'm gonna expand my loop and I'm gonna pull this light blue thread into that loop. Okay, that's how I'm gonna do it. So I'm gonna expand my loop with the middle finger. So as soon as I fold the middle finger, that loop is getting expanded. And I'm placing my middle finger and taking the light blue thread into this loop. I'm going to catch it between the middle finger and ring finger, and I'm going to release my thumb and index finger. That's released so that the light blue thread is free, and just pull it inside. That's it. Just let me know if this much is done, and I'll move ahead with the second throw. So you need 2 throws to tighten the knot.
Sir, we have a question.
Yeah.
We have a question. So
Yeah. What's the question?
from Anuj, he's asking, can you please tell me where should I hook the thread?
Hook the thread or hold the thread?
Sir, actually, yeah. So actually, I have this thread with me, but I don't have something, to hook. Like you have made a hook on that. You have looping this thread. I don't
Yeah. You have any, you can loop it around your chair or something if your chair have railings.
Okay, will
Chair, or you have a, door handle, you can hook it around that.
so a
Handle.
bottle will do.
Which one?
So a bottle.
Just take
Bottle
a
won't be
mug.
stable. A
Okay.
door handle will do. A door handle, you can stand against a door handle, Anyway, door
Okay,
handle
sir.
has a hook, right?
Sure.
Something which is steady so that, once you tighten it, bottle, I don't know.
You can loop it around a mug handle if you want.
Yeah,
Okay,
correct.
sir.
Mug handle also will do. Yes. If this much is clear, I will move ahead with the second throw. I'll demonstrate it again. So you have hold it in 2 hands, cross the threads so much so that the right hand thread is below the left hand. Again, with your right hand, you make that finger like with the thumb and index, you catch hold of the thread, and with the other 3 fingers over the loop, you invert it. Okay, you invert it just like this, and you keep with the left hand thread over the right hand thread. Then fold the middle finger, expand the loop, take this thread into that loop. Okay, and square it. So you can see a square knot is being formed. So that is a first throw. So once you've done that, we'll move ahead with the second throw. Second throw again. So what you have to do is you have to make a four kind of thing. Can you see a 4 here? 4 letter. Number 4. I'm gonna make a 4 with this. Okay, so for making a 4, how we do is So catch hold of the thread between the thumb and the other fingers. Fold. Using your index finger, you fold this thread and place it over the other one. See? Just like this. So number 4 is formed. Can you see a number 4? I've formed a 4 here. Okay, so basically I've created a loop. Now I'm gonna take this thread into that loop and pull it out. And I'm gonna tighten it. So that's how a reef knot is formed. So this is a reef knot. We call it as a reef knot, which doesn't get loose. So I'll demonstrate this step again. Okay, so with the right hand after the first row, so make a 4. You can see a 4, and I'm gonna fold my index finger here now and take out this blue thread into this loop, hook it up, and take it, and made it through, and turn my hand and square it and make a knot. Okay, so that's how we do it. So once you gain the speed, once we do it, it'll look like this. So you crossed it, you take the first row, you take the second row, it'll be like this. And the next row, and the second row. So once you've gained enough speed, this is how you should do it. It's very fast. You don't need any instrument to make a tie. So we can tie anywhere else too fast and can save time intraoperatively. And all the deeper sutures, if you want it, doing abdomen surgeries or surgeries in the pelvis, deep in the pelvis, you can, with your index finger, we can knot it and you can place a knot. That I'll show you. So once you get the technique. Is this clear? If you have any doubts, you can please ask.
So can you demonstrate the second throw again?
Yeah, sure. So the first row, cross, wind it around, keep it over it, fold the middle finger, keep it in the loop, and tighten it. Second one, you don't have to cross it. You keep it like this. Okay. With the index finger, bend the thread, keep this vertical, bend the thread on your right hand with the index finger. See? Bend it. I'm bending it. I'm bending it like this. Holding the other part with the thumb and the other 3 fingers and guide it with the index finger guiding. I'm bending this thread and placing it over. I've made a 4, number 4 kind of design here. You can see this is a 4, number 4. See, this is a number 4 design, number 4. So
Yes, sir.
yeah, I've made a 4. Then what I'm gonna do is I'm gonna take this dark blue thread, into this loop. I'll show it again. Make a 4. I'm gonna fold and take this dark blue thread into this loop, just like this.
Okay.
And hold it between the middle finger and index and tighten it.
Okay. Understood.
Okay? Yeah. Is everyone able to do it? Once again. I'm gonna tie it around. Okay, like this. I've flexed my middle finger, took it into the loop. I made a 4, and I'm gonna take this one into this loop, cut hole between the middle finger and index finger, and square it. See, it's gonna become a squared reef knot. Are you guys able to do it? Great. So that's all for the basic session. Do you guys have any doubt? Please feel free to ask.
Thank you very much, sir, for the excellent and highly informative session.
Yeah.
We will now move on to the Q&A segment. Participants who have questions may either raise their virtual hand or type their questions in the chat box. Anyone with a question?
Any questions? If you have any questions, you can ask me now.
So you have mentioned about the tensile strength of the suture at the start.
Yeah.
So does that help in deciding which material to be used in a particular kind of surgery?
Yeah, basically for suturing the skin is where, more elastic, the more tension elastic thing in your body is the skin. So for suturing the skin, you need a good material with good tensile strength. So we use monofilament sutures, which has good tensile strength for the skin. For the subcutaneous tissue, we can use absorbable sutures, like vicrinolol gets absorbed in 90 days. So by that time, the subcutaneous tissue will get healed and, well approximated. So you can use non-absorbable for less tensile strength for a subcutaneous tissue. And again, coming to the rectus sheath, you know that if you don't close the sheath properly, it can weaken the abdominal wall and that can lead to a hernia. So to close a sheath, you need to use a material which has good tensile strength, like we use like PDS. PDS is a delayed absorbable monofilament suture, so it takes 180 days to get absorbed. So we can use PDS for closing the rectus sheath, which is monofilament, and which again has a good tensile strength. So what happens if we use Vicryl to close the sheath?
Yes.
It has less tensile strength. It might give away, and that can lead to hernia. So that's when we think and decide where to use which material.
Thank you, sir.
Yeah.
Any more questions? Please feel free to raise.
Sir,
Oh. Okay, go ahead. Go ahead.
I hope you
Lakshmi.
all got the technique of suturing. I hope.
yes, sir. So what type of suture, like when we are doing that hand suturing knots, what surgeries are specifically done for this type of knots, sir? Especially the grief knot you thought recently.
No, any knot you can tie with hand. Basically, any knot, like any surgeries, any knots, even for the fixing the drain, you can use a hand knots. So any suture thing, you can use hand knots because where like during the surgeries, like so suppose you need to tie a blood vessel, so you don't have to take just like in suturing material, the needle and to take the blood vessel. You can loop around the suture material around the vessel, and you can do the hand knot. You understood? So the same way.
Okay, sir.
Okay. Thank you. Sir, we have one question in the chat box from Anu.
Okay.
He was asking if you can repeat the three-finger eversion part.
Repeat what? I didn't get you. Repeat
The three-finger eversion part.
Okay, yeah. Just 1 second. I'll just do that.
Thank you.
I've crossed the threads. So the right side thread below the left hand one. Okay. Then I'm gonna do is catch hold of the thread between the thumb and index finger. Stretch the three fingers. Place it over the thread and just invert it. Just like this. See? Hold it. Three fingers over this thread. Invert it. And place this one over this thread. Okay. And flex your middle finger, and you're expanding this loop. So this is a loop which I was talking about. This loop, this entire thing is a loop. So I'm gonna stretch the loop with my middle finger. Basic idea is pull this light blue thread into that loop. So I'm gonna pull it, catch hold of the light blue thread between my middle finger and ring finger, and I'm gonna leave the thumb and index finger. I left it so that it'll go inside. Sorry, it'll go inside. Just hold 1 second. Yeah, I've looped around, flexed it, got it, and looped around, and I'm gonna tighten it. That's the first throw. Second throw again, I'm gonna make a 4. You can see the 4 now. I'm gonna flex my index finger and catch hold of the light blue thread, get out into the loop, cut out of between the middle finger and index finger, and I'm gonna square it now. See, I'm gonna square it this way. Yeah. And that forms a reef knot. So this is a reef knot. So I'll just show you what is a reef knot. I'm not sure whether you'll be able to see it, but I'll try to demonstrate it. 1 second. A reef knot means so you can imagine this as a loop. Imagine this as a loop. This one is a loop, and you have two threads going out on one direction and two threads going on in this direction in a loop. So you can see that these two threads are going above the slope on one side, whereas on the other side, those two threads are going below the slope. That's how an ideal reef knot should look like. So imagine this circle loop. One side, two threads are going above it, and the other side, two threads are going below it. You can see it. I hope it's clear. Is it visible clearly or is it blurred? This is very important. So if you get
It's visible.
if you get this configuration, that means you've placed the knot in the right way. So this is called a reef knot. The other one, if it comes ulta, that means this one thread is above this loop and this thread is below the loop. That means you've tied a granny's knot. And if you're tying that knot around a vessel, that will inevitably will become loose and this patient might bleed. So when you place the thread properly, use this correct technique. Then only you'll be able to place this reef knot. So two threads above this loop, and on the other side, two threads below that loop. This one is going below, and this is also going below that loop. If you can see, two threads above and two threads below the loop. So this is a magnified configuration of a reef knot. I just wanted to show you that. So what is your end result, what you're tying? So that's a secured knot.
So can you check, like, are we aiming for this?
Pardon me?
Are we aiming for this, like this?
Yes, this is what we are aiming at, this configuration. I just wanted to show you this magnified view. Like when you're trying with a normal suture thread, you won't be able to understand it because it's very small. Our eyes can't see all these things. So the final knot.
Understood.
But if you tie it in the correct way, you know that you're going to tie a reef knot. You understood? So if you are tying it the right way, you know that you won't get wrong. So you're going to tie it in the proper way. So that's why the technique is very important. So you know that you're going to tie it properly and you're going to place a reef knot, and it's very important. So with this thread, you will know how magnified it is, and you know that you're placing the right knot. So that's it.
Thank you, sir.
Yeah. Any further
On the
doubts?
chat, Tanvi was asking if you can please demonstrate the subcuticular suture starting part.
Subcuticular suture starting part.
Yes.
Okay. Okay. Just one
Thank
second.
you.
Okay. So this is the wound edge, if you can see. So I'm going to end up perpendicularly at the edge of the wound, almost 5 mm distance from the edge, and come out through the exact corner of the wound. Is it clear? Or I'll show it in this way. So we're going to enter perpendicularly at a distance of 5 mm. So this is the wound edge. We are going to enter from here. Enter perpendicularly from the wound edge and come out through the wound edge. And pull it out. And now you're going to take segment wise. So the first segment, you start from the other end, close to the wound. In subcuticular fashion, you take the first throw. Okay, that throw didn't go through. One second, cut through. Okay, that's the first throw. And the opposite side, the same segment you're going to take in the subcuticular fashion. Okay, so like that, you're going to go all along the wound the same way. So this is a starting part. I hope it's clear.
Yes, thank you, sir.